we're going to talk about acute pain. So the difference between acute pain and chronic pain is huge in TCM. I think when we talk about chronic pain, we have to do a TCM diagnosis that's very in depth, and we want to figure out the root cause, the diagnosis itself, and we want to treat the root. It's not what we're going to talk about today. We're going to talk about acute pain. So when it comes to acute, we treat more the symptoms itself because we want to relieve the pain that is happening right now. When we talk about acute pain, we are going to treat the symptoms. You want to make sure you also treat the root cause of the problem if it is something that's recurring. So there's a difference between recurring headaches versus an acute injury like you sprained your ankle, right? So we're going to talk about all this: general pain, general acute pain, then trauma injury, then we'll talk about headaches. Effectively, there are lots of options, and we have a lot of tools in our TCM toolbox, right? You're probably familiar with Dr. Richard Tan or Master Tong's method of treating pain. Let's start it up by looking at general pain. I started with stomach 36. The reason I'm starting with stomach 36 is because if there is an acute pain, let's say a trauma injury, a bone fracture, headache, anything, you want to use stomach 36 for the only reason is that it's a healing point. It is what I call the vitamin C of the acupuncture points, right? It's like you're boosting. It is the commander point of the immune system. So it is boosting your body, and it is a really good point to maintain overall health. Using stomach 36 is going to help boost the healing process. It's great to use after surgery. It's great to use if you've had trauma injury for healing purposes. As a basis, it's a point that we should put in any kind of pain or recurring pain, because if there is recurring pain, we still want to look for the root of the problem and step back, but we want to try to heal the body, and stomach 36 is such a base point to start with that. So the next thing I would put is, unless your patient is pregnant, is Li4. Of course, Li4 is the best point for pain. And the reason it's the best point for pain is because it is a point that moves blood, right? It is counterindicated during pregnancy for that reason. So it is one of the best points to move blood. When there is pain, specifically acute, localized pain, it is due to blood stagnation quite often, not always, but there is always some kind of blood stagnation. It could be blood stagnation with heat. It could be with excess cold, which congeal, becomes like an ice cube, and then stops circulation, right? It could be a lot of different other patterns and pathogen that can block blood. But when there is localized acute stabbing pain, that is always a blood stagnation. And so Li4 will move blood, which would be really good for any kind of pain, right? Because it will release the blood stagnation. Now, do you want to put liver 3 with it? Sure, because liver 3 moves chi and chi moves blood, right? So opening the gate, doing the 4 gates, and doing liver 3 and Li4 is probably a good idea. Okay, so those are the basic points. If you start with those 2 points, we're having one healing point, like I talk about the vitamin C point, and then we have the point that's going to release the pain. It's going to help to move the blood and try to release the pain. So that's basic stuff. Okay, so that's general, basic for pain. Now let's start to talk about local versus distal. When there is pain, and this is why Dr. Richard Tan or Master Tong methods of doing acupuncture works really well, because usually it's a mirror kind of method and it's a microsystem, and that microsystem is used usually as a distal system, right? In classic TCM, we want to do points or acupuncture points that are going to be in the local area. So if I have pain in my wrist, I want to do local point in the wrist to release the pain. I want to do stomach 36 to help the healing process, and I want to do Li4 to move blood in order to release the pain, right? But we also want to put distal points that are going to help really bring lots of circulation and allow the pain to get better in that area. So distal points like lung 7. I love lung 7 because it is, as a reminder, the commander point of the head and neck, right? So if there is any kind of pain up here in the neck, in the SCM, right, in your sternocleidomastoid, if there's pain anywhere in the head, obviously that would be more headache, painful headache, or any tension that's happening in the scalene in the back here, right? So any tension that's attached to the neck. So even traps, because your trapezius are attached, right? So anything in the neck and head, you have to put long 7 as your distal point if there is pain in that area. Of course, Li4 is your point for moving blood, for any kind of pain, but Li4 is also the commander point of the face. So any pain in the face, like jaw, a lot of people have jaw tension, right? Of course, you're going to do local point, but you have to put Li4 because it is going to release the pain in the face. So jaw pain, toothache, having sinus headaches or sinus pain, right? It's definitely the face, right? So Li4 is really, really going to help if there's anything happening. If you have eye pain, pain behind the sinus, all this, yes, exactly, all the face. So we want to put Li4. When it comes to PC6, pericardium 6, we want to use it when there is chest pain. So any kind of chest pain or chest discomfort, PC6 will be really good. So chest pain doesn't mean necessarily just heart-related or physical heart-related pain. It could be that there is esophagus pain, right? Behind the sternum, your esophagus is painful. Maybe there's really, really bad heartburn. Maybe there is pain that feels like we can't breathe, right? It's pain that's affecting the lung. Maybe it's an anxiety attack, but it feels really painful, right? No matter what, PC6 is great to relax the chest. So it's a really good distal point when it comes to chest pain, and of course for physical chest pain as well, and for heart pain. So the distal points are going to work very well. Stomach 38, which is located on the lower leg, far away from the shoulder, is one of the best distal point when there is shoulder pain. So if you have shoulder pain like rotator cuff injury, frozen shoulders, of course you have to do local point. There's a lot you could do, right? You could do cupping, you could do trina. There's a lot you could do, electrostimulation, but you want to do your distal point, and stomach 38 has to be there. Now, one of the questions my students ask often is that, do I do it on the same side of the pain, right? Or do I do it on the opposite side? I am a very big proponent of doing it on the opposite side because the opposite side should have stronger chi. It's not as affected, right? So I found that you could do on both sides. Of course, you could do bilaterally, but it depends if you have too many needles, if the person is weaker or very deficient. You don't want to overwhelm them with too many needles, right? If you have someone that has frozen shoulder and they're 75 and very weak, you're not going to put like 35 needles. That's way too stimulating, way too strong, right? So we want to keep it smaller. So the idea is to do points on the local area, and then you could do opposite for stomach 38, so opposite side. Plus, remember that in general, like the large intestine is the only meridian that crosses the body. At the face, it crosses the body. No other meridian crosses the body. Having said that, if you have a shoulder plane, which is more large intestine meridian per se, doing the opposite side will bring a lot more chi and blood to the area. Spleen 6, I think sometimes we forget that spleen 6 is a hip commander point. I love spleen 6, a great point. It is counterindicated during pregnancy, but the rest of the time it's a great point because it crosses 3 meridian, right? The kidney, the spleen, and the liver. Crosses those 3. So if there's liver issue, spleen issue, or kidney issue, yes, it's fantastic, right? So spleen 6 is really good when it comes to hip issues. And when I'm saying hip issues, I'm not saying just the hip girdle. If you look at the hip girdle, if you have anything in the hip flexors, so musculoskeletal issue, you have to put spleen 6. If it's in the front and the back or in the side, so meaning if you have sciatica, I would put spleen 6 because it is part of the hip girdle, the sciatica, right? If you have sacrum issue. So anything that's happening MSK or musculoskeletal wise, I would put spleen 6. But also internally, if you have pelvic inflammatory disease, very painful menstruation, I would also put spleen 6. Bladder 40. Bladder 40 is one of the best point for lower back, right? So anything happening in the lower back, and I would say lumbar and sacrum, at the same time. So lumbar and sacrum would be part of the lower back, and that you have to put bladder 40, right? Bladder 40 is the commander point of the lower back. It's a distal point that's going to help when there is lower back injury or pain. And that's really acute at the stage of the acute part of the pain. And stomach 36 is a great point, again, not just for healing, like we said at the beginning, but for stomach area, right? Because it's also a commander point of immune system and abdominal area. So if there is abdominal pain, you want to do stomach 36 for sure, because it is the commander point of anything that has to do with digestion, right? So if there's any digestive pain, we talk about distal point, right? So I want to talk about pain itself. So the chi clef point, love the chi clef point. So the chi clef point in general are going to treat most of the yin chi clef points are going to be more relating to blood issues, TCM blood issues, by the way. And then the yang chi clef point are going to be related more to pain, specifically acute pain issues. So when there is acute pain, you want to look for the right chi clef point and insert that one in there. Often there will be a distal point as well. So you want to do the local point, of course, but you also want to do distal point. So you have to put stomach 36 for acute stomach pain, because anything happening in the digestive system, you have to put stomach 36. And then stomach 34, tutsun above the lateral superior angle of the patella, so on your thigh. So stomach 34 is going to be really good because it's the chi clef point of the stomach for any kind of acute stomach pain. And of course, you could also do stomach area, like when 12, stomach 21, to relieve the pain locally. Sometimes people don't want to be touched on the stomach because the pain is so bad. So do your distal point, right? LI4, stomach 36, stomach 34, right? All those are going to help a lot as well. Sore throat, if the sore throat is really, really bad, LI7, so large intestine 7, is really good when there is like strep throat, like the shard glass that goes in there. That's a really good point for that. Acute leg pain, specifically, if people have a lot of cramping, calf cramp, or really painful spasm, you want to put a gallbladder 36. For acute ear pain, Sanjiao 7, very good point for acute ear pain as well. So again, you want to treat the root cause, etc. But in the meantime, LI4, right, for ear pain, and then your Sanjiao 7. Small intestine 6 is great when there is sudden arm pain, like maybe someone has carpal tunnel, or they have a tennis elbow or golfer elbow. That helps a lot. For painful urination, bladder 63 is the point for any kind of acute urination pain. One of the points that I love to use is kidney 5 and spleen 8 when there is dysmenorrhea. So specifically when the dysmenorrhea is happening. With dysmenorrhea or painful menstruation, you want to look at the root cause always. But today is the day that the person is coming to see you and they have really bad cramp, right? They're really in pain. You want to do kidney 5 and spleen 8 to relieve the pain at this time right now. Then you want to figure out what's the reason for the dysmenorrhea, or what's the TCM pattern, so you can address the root cause of the problem so you can get rid of it and help the person not have this eventually after the next cycle or the one after that, depending on how long they've had it, what the cause is, etc. So this is a really good combination, kidney 5, spleen 8 for dysmenorrhea. Another one that I like to use a lot also is heart 6 with PC6, 2 6s. Heart 6 and PC6 together, great for chest pain. So PC6 because it's the commander point of the chest, and heart 6 because it is the chi clef point of the heart. So chi clef points, as you can see, are so fantastic when it comes to having pain that is needed to be addressed. And again, do the local area and do the chi clef point with the distal area. That is going to be a very easy, fast treatment, and it works really, really well. Like I said earlier, there is a lot you can do for pain, and electrostimulation can be part of your treatment, moxa, cupping, there's a lot. I'm only talking about acupuncture today to make it simple and easy. I wanted to tell you that all the slides today in my presentation are from my AcuPoint Made Easy. If you've never seen it before, That's the book right here. And this is the PDF or digital version. If you want to know how to get it, the link is below, or you can go to my website. So when it comes to acute injuries or trauma injury, we have, let's say, a sprained ankle, or you strain your wrist, right? Something happened, you went skiing, or you fell off a bike, or for some of us, you just don't look where you're going and you fell off on the sidewalk. That can happen too. We've all done that. So if there's an acute injury, as in the ligament, tendons, and joint injury, right? So if there's an issue like this, I would like to look at what it looks like from the perspective of symptoms. And then what does that mean in TCM perspective? So the first thing is there is pain that is local and it's stabbing acute pain. Let's say it's a sprained ankle, right? So if I sprain my ankle, it is going to be stabbing acute pain. Stabbing acute pain in TCM is blood stasis, right? That is stabbing acute pain. It's like purple in the area, it's really bruised, you sprained your ankle, it is stabbing pain. So when there is stabbing acute pain, that usually most of the time turn purple pretty quick, that is blood stasis. The second thing is most of the time when you do an acute injury, there is swelling, right? It's going to swell in that area. Swelling is usually dampness. The third thing is there's massive inflammation, right? That's the body's response to the acute injury. So there's inflammation, which feels usually hot to the touch, right? So inflammation and hot to the touch is going to be excess heat, right? So this is excess heat in there. Blood stasis for the pain, dampness for the swelling, and heat for the inflammation. Now, this is why in conventional medicine, they're going to say, let's put some ice on it to bring the inflammation down because of the heat, right? In TCM perspective, we usually don't like to put ice anywhere, right? Because it blocks circulation. So it's a very different approach. But at the same time, you do what you feel is best for you. I'm just telling you that's a TCM approach, right? Because we're talking TCM right now. So when you have, let's say, this ankle sprain or the strain of the wrist or whatever acute injury that happened, right? Maybe you rotator cuff injuries. We want to first, in the acute stage, we want to address those three things, right?
This video is sponsored by Jane, the practice management software and electronic medical record. I jumped in with Jane years ago when I went from paper, hello old school, to electronic, keeping up with the times. Running a practice, as you know, comes with a lot of moving parts, and Jane has been a game changer for me. From scheduling to charting to keeping everything organized and running smoothly behind the scene, Jane totally rocks. If you're curious to see how Jane can support you and your patients, I highly recommend you check them out here. And one last thing, if you're ready to start with Jane, you can use my code AcuPro1MO, 1 month, to get a 1 month grace period on your new account with Jane. The link and the code are in the description below.
So the first thing we want to do is we want to move blood because there's blood circulation issue. So move blood, we want to do Li4, which we had said no matter what, we have to put that point because it is a point for pain. It relieves pain, right? So it has to be there. I would also put liver 3 because liver 3 moves chi and chi moves blood. So to open the gate, get the flow going. In general, you want to start with this, right? Then you want to remove the dampness. So usually one of the best points to remove the dampness will be spleen 9, right? We would put spleen 9 to decrease the swelling. And then we want to get rid of the excess heat, or we want to bring the heat down. So basic point to bring the heat down would be Li11. So you start with just that. You decrease the heat with Li11, you relieve the swelling with spleen 9, and you move blood with Li4 and liver 3. So that's the first thing you do. Okay? Then, of course, if it's affecting the tendons, the ligament, the joints, which it could be if you have like rotator cuff injury, if you have sprain of your wrist or strain of your ankle, so you have to put that influential point of all the sinews, tendons, ligaments, joints, which is gallbladder 34. So now you have to put this. So if a patient just sprained their ankle, this is very simple. Everybody can get that done. Then you want to do local points, right? You have to do local points wherever the injury is, and distal point as well. So you want to do local point and distal point, right? So to help out. You want to do stomach 36 to help the healing process go faster, right? So we have the local, we have the distal, and we have stomach 36 for healing perspective. So if you do this, the closest to the injury time, the faster the recovery. The closest to the injury time, the faster the recovery. If you just have the patient that sprained their ankle today or yesterday, the healing is going to go so fast if you do acupuncture right away on it. If it's a week later, it might take a little bit longer, depending on the person's basic pattern. If they're very weak, very deficient, the essence is low, or they're older, or they have really a weakness, as in they're very deficient, it might take a long time to heal, right? So it depends on a lot of factors. But in general, the closest to the injury, the faster to the heal. When you look at a bone fracture, you want to make sure that you are going to start the healing process. So let's say you broke radius and ulna, you can do point on the other side, right? Couple of points that are great that are local. But in general, your best bet is to address the problem. First, the problem is there's pain. So Li4 has to be there. Stomach 36, like we said, that's for healing purposes. So we want to make sure we do that too. And of course, when you broke a bone, you need to put the bone point, right? The influential point of the bone, which is bladder 11. We want to put the marrow point, gallbladder 39, right? So this is what we want to do. Then because when there is a bone fracture, blood is affected because we need, obviously, bone marrow produce the blood, right? So we need to also address the blood. So bladder 17. And of course, joints, ligaments, and tendons in that area have been damaged as well. So gallbladder 34. And then, of course, muscles in that area are going to be affected. First with pain and inflammation, then with atrophy, right? There's going to be an atrophy that's going to happen 2 weeks later because we're not moving, specifically if you wear a cast, right? So spleen 21 is a great point to help all the muscular region in the body. I would probably also put spleen 6. And the reason I would add up spleen 6 is because spleen 6 is related to liver, kidney, and spleen. Spleen is related to muscle, liver is related to tendons, joints, ligament, and kidney is related to bones, right? In the 5 elements. So bone with kidney, liver with sinews, and spleen with muscles. Let's talk about headaches, right? Acute headaches, for the treatment of acute headache. When it comes to headache, one of the points that I like to put when there is migraines or headache is long 7. And the reason is it is the commander point of the whole head and neck, right? So anything that's happening headache-wise, doesn't matter if it's occipital, if it's frontal, if it's temporal, vertex, the whole head, you want to do the long 7. Any kind of headaches, you want to put long 7. Obviously, Li4 because it also relieves pain. So I'm talking about at the time of the headache, right? There is a difference between the root cause of the headache, which we have to have and to look for, so we prevent the headache or the migraine from coming. But if it's happening right now, right here in your office, then I would definitely put Li4 and long 7 unless the person is pregnant, and then I would not do Li4, right? In general, once you put long 7 in there and Li4, that's your distal point, right? But there's more distal point depending on the area affected, right? When it comes to headache. Again, this is just acute. We're not talking about the root cause. One of my favorite things to look at is the location of the headache. I'm going to start temporal because it's one of the most common one, right? The one on the temple, if you have a temporal headache, you want to do your long 7, your Li4, and then you want to do local point, right? Local point like gallbladder 20, Taiyang, right? So those 2 points are going to be local that are going in the area. If you want something like gallbladder 8 or gallbladder 9 or Sanjiao point, anything in this area, you can do to help relieve the pain. And then you want to do your distal point. So yes, long 7 Li4, but your distal point would be gallbladder 43, one of the best points for headache on the temporal region. Make sense? Okay. So if you have occipital headache or tension headache, which a lot of patients have, right? A lot of people go, oh my God, I have such a tension headache. You are wanting to put local point again. So gallbladder 20, of course, right? You could do bladder 10, which are all in the occipital region in the back here. So that's good as well. And the best point that is distal for occipital headache is bladder 60, right? Because the bladder meridian goes in the back. So bladder 60 is really good when it comes to occipital headache, and it's further away from it, so brings the energy down. And again, you're along 7 Li4, right? Stomach 36 to help the process faster. I'm repeating it, but because I wanted to make sure we grasp the whole thing and fast and easy. If you have patients that have headaches that are frontal or orbital behind the eyes, or frontal, that's more of a stomach headache, right? So it could be due to dehydration, etc. But today they're coming and it's like, oh, I have a bad headache here or behind the eyes, it really hurts. You want to do stomach 8 because stomach 8 is your local point, and do 23. So all local point. You could do yin tong, that'll help as well. Gallbladder 14, anything that's on the area. Plus, you want to do stomach 44 because it is a stomach meridian issue. So you want to do stomach 44 as your distal far, far, far away point. Good. The last but not least is the vertex headache. So this is not as common. Vertex headaches are not as common in general, but some people do experience the top of the head, that's really painful. So of course, do 20 is right there. So you could do anything that is local, like bladder 7, all around. Do 20, like Song, which is a extra point or 4 extra point around do 20, and then liver 2. You want to bring the vertex headache because that's a Julian headache, which means it's a liver headache. You want to bring it all the way down. So liver 2 is far away. Sometimes you can use kidney 1 if it is really more of a kidney issue, but generally it is going to be more a liver issue. So liver 2 would be your best bet. So this is what we look at when we look at distal versus local headache that is acute.